is still getting warmed up. It has a lot of places left to go. And I think the reason we've responded so dramatically is because we see the potential for it to take a toll far greater than flu does in a typical season.
Hello and welcome, Quarantine World. I'm your host, Dylan DeMarcus, alongside Adam Gopin and Britt Barrett. And today we are grateful to be talking with Dr. Alex Blau, who is an emergency medicine trained physician who runs a specialty clinic for immigrant community in New York City. He lives in Brooklyn, where he recently spent 2 weeks in strict isolation, overcoming a confirmed case of COVID-19. He's grateful to be alive. And together, we're grateful to share Alex's direct experience of dealing with the virus along with his medical wisdom in hopes to provide you value in helping shine light on this global pandemic to get some clarity on how to mindfully and responsibly navigate the coronavirus with both perspective and compassion in order to keep well-being of our mind, body, and souls thriving during these times. And in regard to the corona, feel like we should be in alignment with publicly mandated precautions, increasing cleanliness, boosting our immune system, while being mindful of engaging too much within groups currently, as well as keeping a healthy amount of discernment on where we are getting our information from, while remaining grounded and calm. And additionally, as a disclaimer to all the viewers, the medical information provided today is merely just information and not direct advice. So if users do need direct and specific medical advice, please consult your personal medical professional. And with that said, Adam and I and Britt are also privileged to introduce Dr. Alex Blau to the conversation. So Alex, first and foremost, I'm super glad you were able to bounce back from your experience with the virus and finally getting back to health, as you have a very unique take on this, considering you are a trained physician. So if you're willing, can you share how this all started with you and what your experience was like dealing with the COVID-19 firsthand, along with any other medical wisdom?
Absolutely. And just thank you, all of you guys, for inviting me here and giving me a space to talk about my experience personally with this, and then my broader perspective as a healthcare provider on what's happening right now. So I guess I'll start by saying that the last few weeks have been trying. I got sick about 3 weeks ago now, and it all started very nondescriptly. I had a bit of a sore throat. Didn't think much of it at the time. It was after a recent travel to San Francisco. I'd just flown back from a visit to see friends, and after about a week of that, I suddenly felt feverish one night, and I had fevers off and on for the better part of a week, during which I developed a cough and then some breathing problems, which is starting to coalesce into that more typical picture that we're hearing about with COVID-19. As soon as the fever kicked in is when I started isolating. Mm-hmm. So I've been hanging out for most of the last 2 weeks in this spot, my apartment here in Brooklyn, and grappled with the fevers and this kind of difficulty with my breathing for the better part of a week. That was interrupted at one point by a trip to the emergency department when my breathing got to the point where it was frightening me. And that's the point at which I got tested, which was a little out of the ordinary. So even at this point, it's still difficult to get access to testing, and testing is for the most part limited to people who are being admitted to the hospital as a means of preserving available tests for those who are most in need. Because of my status as a healthcare professional, I was able to get testing because they want us back in circulation as soon as possible, and they want to confirm that we're either positive or safe to be giving care to others. So I was fortunate that I was able to get tested. Still, the testing at that point was taking about 2 to 3 days. So I came back to my home to continue to convalesce and wait for my test results for the better part of 3 days. So, and then I got my test results. I was positive. I was still having the fevers. And then eventually, towards the end of that week, the fevers broke. My breathing gradually got better. my energy started coming back.
Mm-hmm.
So that was, generally speaking, the physical course of the illness. Yeah. Adam?
Quick question for you, Alex, just about the breathing, right? Because we all hear the symptoms, and I know, like, I have a little wheeze, and it's sort of there's sort of the mental component, like, oh, is my breathing like difficult? Is that normal? What was that breathing kind of sensation that got you to go, oh, this is real, I want to go get this checked out? What did that feel like for you?
Sure. That's a good question. So for me, I was having a bit of an asthmatic response. So what I was having was some chest pressure, not so much difficulty breathing in, getting a full breath, but rather my exhalations were tight. And I ended up treating myself with an inhaler and then eventually a nebulizer. So basically a tube that you breathe through for 10 minutes at a time every few hours that gives you albuterol, which is this substance that helps to relax your airways. So that I became pretty dependent on that for a few days to keep my breathing comfortable. That's not the typical pattern with COVID-19, but at the time for me, it represented a breathing challenge, which was frightening just in and of itself. And we're still learning so much about how this disease actually works that, we've only just really uncovered recently the effect it seems to have on smell and taste, for example. So, for all I knew, this was just another oddball manifestation of COVID infection, this asthmatic response. And I still don't know whether that's the case or this was just my own personal reaction to it for some reason, not having a history of asthma myself.
How long did you have symptoms until you were like, okay, there's something like seriously wrong here, I need to get tested?
I knew I was at risk the second I started having fevers. It was possible that I had flu or that I had a cold, given the season. But given this is circulating so widely at this point, and especially in New York where I'm located, as soon as I had fevers, I knew that there was a good chance that that's what I was dealing with. If you're asking when did I know that I needed perhaps outside help, that was when the breathing issues really kicked in. For the most part, people seem to be able to weather this disease at home with just supportive care, right? As you would with any flu or cold. Resting, staying hydrated. It's really important to replace fluids when you have a fever that lasts a long time or a cough that lasts a long time. You lose a lot of fluids that way. Mm-hmm. So hydration is really important. And then taking Tylenol or other fever-reducing medications for comfort. Mm-hmm. And that's pretty much what most people can do at home, and that's what I was doing. But once the breathing issues kicked in, and I had to start taking an inhaler and then move from the inhaler to the nebulizer, that's when I said, all right, we're getting to the point where I may need some outside help. And I specifically went to the emergency room basically to have someone check to see that I was oxygenating appropriately, that I was getting enough oxygen to my tissues, which is not an easy thing to check at home. You need a pulse oximeter. And it turns out I was still oxygenating fine. But I wanted that reassurance because I was aware enough of my breathing, of the discomfort and the work of my breathing, that I needed someone to tell me, no, you're still doing okay. Mm-hmm. Which I think leads me to one of the bigger issues, or another big issue with this particular illness and in this particular moment that we're all sharing socially around this, which is the active participation of fear in the experience, right? So for me, as I look back on this, physically, this was like a bad flu for me. And people have very varied experiences from a health perspective to this. It was like a bad flu with some reaction of my airways that gave me a bit of asthma. Not enough to put me in real danger, but enough to be aware and need a little treatment. That in and of itself is not all that uncommon and not all that concerning.
Mm-hmm.
However, the fear that I was confronting, even with all of my training and experience as a physician, was such a powerful part of the experience, and I think probably even magnified my experience of the symptoms to some extent, especially the breathing. It's very easy when we're fearful or anxious for it to show up in our breathing, for us to hyperventilate or to become more aware of the work of our own breathing. So it was absolutely contributing to my physical experience of it.
With that said, Alex, I'm curious, is the pandemic worth panicking? And when the energy of fear and panic are present in our bodies, do you think that really does have an effect on our immune system? Like, I've heard it can lower it to 1 to 2/3.
I mean, it's a very interesting question, and I'm gonna hedge a little bit here by saying, I'm not an immunologist. This isn't really my field of expertise. I will say that we are complicated physiologically, and our emotional states absolutely contribute to our physiological states. So, fear, stress have very measurable effects on our hormonal responses. Cortisol is a big player in that, for instance, and that affects any number of different parts of our physiology, including immunology. Mm-hmm. So I absolutely believe that being in a state of fear, anxiety can contribute to our immune response to this. How exactly, I'm going to defer to my colleagues in immunology, but yeah, no, I believe that being in a mass state of social panic probably does increase our vulnerability to some extent to what's happening from a disease perspective. Yeah, I believe that.
Right. I hear you. And I was curious, so I pulled up the CDC recently, and it said an estimated 65 million Americans nationwide were affected with the flu during the 2018 and 19 flu season. And the National Center for Health Statistics said 7.1% of all deaths in America in the week of March 7th, the week before we started shutting our country down over the coronavirus, were due to flu and pneumonia, and did not result in any draconian government shutting down. And by comparison, as this recording, the current U.S. death rate from COVID was around 1.3%. So, given the available data, our historically staggering response just doesn't seem to make sense to me. And I feel like it suggests further questioning in order to objectively separate the pathology of the virus versus the psychology of the public policy that we're being asked to submit to. So, Alex, I'm curious, do you think the cure specifically addressing the complete shutting down of our way of life is worse than the disease?
That is a big question, and a complicated question. I will say this. I think it is a bit apples and oranges to compare what's happening right now with the novel coronavirus and COVID-19 to seasonal influenza, because one, you should remember that what we're seeing right now with novel coronavirus is just started, and it's starting from scratch. So what we're responding to is not something that's got its full strength behind it yet. This is not full force, right? This is an escalating phenomenon that is growing exponentially. So what we're doing, to some extent, what we're responding to, in our country, in other countries, as a global society, what we're responding to is the nature of pandemics in general and where this could be going. We've faced similar things in the past. We faced this with the SARS outbreak, with the MERS outbreak, and because of our understanding of how pandemics work, about how disease spreads through human society, we were able to contain those effectively. We were fortunate to do so because those diseases, it turns out, have a much higher case fatality ratio than the novel coronavirus seems to. In this case, our response was not as effective for a variety of reasons, and it got out of the box. Containment has not proven to be an effective strategy, or we just didn't manage to make it work. So at this point, it is global, right? It's in most countries across the world and is in most parts of each of those countries. So the question isn't, have more people died of this than of flu or less? This disease is still getting warmed up. It has a lot of places left to go. And I think the reason we've responded so dramatically is because, we see the potential for it to take a toll far greater than flu does in a typical season. You're right, flu is a big killer, but if you look at the last, major pandemic that really got out of the box, got its legs, and go back to 1918 with Spanish influenza. I don't know that we have exact numbers, but it was tens of millions of people that died around the world, and this disease has the potential to do that. So that doesn't really completely answer your question, which is the cure worse than the disease?
Yeah.
And I think that to some extent comes down to how you value the various outcomes.
And I understand that is definitely a very omnidirectional question. And the fact that you're shining light on it just getting its legs and starting to begin, I think it does make sense for all of the precautionary measures that are being taken. And to dovetail off that, what do you think like some of the common misconceptions are in the public view of this virus?
I've heard a number of them. And the one that concerns me in particular is the idea that young people are safe. Young people, I've heard some folks say that young people can't get this infection, which is absolutely not true. We've seen people of every single age who has been able to get infected. There does seem to be some distinction in the severity of the disease that's experienced by very young people. So children don't seem to have very severe disease, disease that requires hospitalization or that causes death with much frequency, which is heartening. That said, if you look at people in their 20s, 30s, 40s, a lot of the folks that seem to think because of some early hand waving about the trends in mortality around this, seem to think that they're safe, that this disease can't hurt them. That's absolutely not true. We are seeing intensive care units that are filled with people in their 30s and 40s. Wow. What the distinction we're seeing is specifically around mortality, as I understand it, is that people, the older you are, the more likely you are to die. But people in their 20s, 30s, and 40s are still getting this disease. They're still getting very sick. 20% of people who test positive are ending up hospitalized, needing supplemental oxygen or mechanical ventilation in the ICU. And they're not dying as often as people in their 60s, 70s, and 80s, but they are dying. And far more so than people in those age categories who get flu, for instance. So comparing it to flu is still inappropriate because in terms of disease severity, for example, for me, and one of the things that I was stressing over as I was wrestling with this disease is that even though I was less likely to die from this than my father is, I'm still 20 to 30 times more likely to die of it than if I had flu
Mm-hmm.
in my age. So we're absolutely vulnerable. And I think that's probably one of the more concerning misconceptions that I've heard from people. Yeah. I've also seen a lot of misinformation shared out there over email that come from totally unidentified sources. A friend of a friend said this. Stanford published this information that says that if you drink, hot water every 15 minutes,
Mm-hmm.
that prevents the virus from taking hold. There's no validity to that I know of. Stanford has disavowed that particular email that seems to be making the rounds. So I in response to that, I would say it's worth paying very close attention to where you're getting your information from.
Are you aware of any legitimate sources to find helpful, objective medical information?
Absolutely. So it ultimately comes down to a matter of trust, and there's no absolute owner of the truth for all of this. It's all in evolution. But I would say the sources that I trust the most would be the World Health Organization, WHO, the CDC,
Mm-hmm.
and then local health department websites are very useful. They're drawing from similar reputable sources, and they're also reflecting local trends. So if you're looking for information that's relevant to where you live, you'll get a lot of that information from a local health department site.
Mm-hmm.
I would also say it's worth going to any of the large health systems websites like the Mayo Clinic, Kaiser Permanente, New York Presbyterian. They're good sources of well-vetted information that generally is drawn from consensus across the medical community, the global medical community at this point. And I think it's worth familiarizing yourself with the information on the disease and local procedures with your own healthcare institution. So wherever you normally go to get care, wherever you're insured, wherever your primary doctor is, if they're affiliated with a hospital, knowing what their response is, what their procedures are and recommendations are for when to come in if you are sick versus when to call. I think those are the places that I would go to first for information and for procedures on how to proceed if you're sick, if somebody in your house is sick, if you've had an exposure, etc.
Cool. Yeah, go ahead, Britt.
I have a question about, there's part of me that's like, I'm done with this quarantine. Like, I just want to get it. I want to get it and be over with it. Like the chicken pox. Like I want to expose myself and just be done. Do you think there's any, obviously, like what's your opinion on like getting it now versus getting it later? Like, is it going to get worse? Maybe are you actually immune to it once you get it? I think I read something this morning saying that people who had it in China and then got cured, like 10% of them got retested positive for it. So just like curious what you have to say about that.
Sure. Well, there's a lot there, and there are some open questions in what you're asking. So I'll start with your first question. Should I just get this and get it over with? I highly recommend not doing that. I have heard stories about COVID parties like chickenpox parties. This is a bad disease. As I said, folks our age are dying from it. I think there's the hope here is that we can buy time for ourselves as a society for a number of reasons. One, the whole strategy behind social distancing is so that we can slow down the spread of this illness. And the point of slowing down the spread is so that we don't have hundreds of thousands or millions of cases in this country all at once. Because if we have that many sick people all at once, it overwhelms our healthcare system, which goes into full shutdown. A small fraction of people are able to get the care they want, which means that the mortality rate goes through the roof. Instead of being able to adequately treat the people who are most severely ill, we have to let 90% of them die because we don't have adequate equipment or healthcare professionals to treat them. We also then, because our hospitals are full, we don't have the ability to treat people who are sick with other things because we're still dealing with all the things we normally deal with. And we suddenly have a vastly increased rate of mortality and morbidity from other causes. That's really not the circumstances under which you want to get sick and risk getting badly sick. Mm-hmm. I don't recommend it. And then the more time we buy, the more we spread out the distribution over time of this illness, the less overwhelmed our resources are, the better care you're going to get for whatever illness you're suffering and need to seek medical attention for. And the more time we buy ourselves to investigate new therapies, to see if the medications that we're trying out right now actually have an impact, or how to use them, in what dosage and what frequency, at what stage of the disease. It buys us more time to work on a vaccine. It gives us more time to learn. Mm-hmm. So for that reason, social distancing, avoiding getting this disease, which allows you to avoid spreading this disease, is really critical for not just your health, but everyone's health.
And in regards to social distancing, shelter in place, and the quarantine, do you think it's like a non-negotiable, super important thing to be honoring at this time?
Absolutely. I think, especially in this country, in the US, culturally, we're very strong believers in individual freedom. And I think this is a real challenge for us around that, because we are being asked as a society to sacrifice our own individual liberties to some extent here for the greater good. Totally. These are communal ideals that I think we all practice on some level, maybe without thinking about it in our daily lives, but we're being called to practice this with consuming intentionality in this moment. And I think the extent to which we can really embrace this as a way we take care of each other in crisis is important, is critical. I think everybody has to do what they need to survive. If you need to, for the sake of your sanity, go take a walk around the block, because you're just going to go absolutely bonkers if you're trapped for one more hour in your house with your 3 kids. Then take a walk. Be safe, be smart about it, be conscientious. If you have a mask, wear a mask, certainly if you have symptoms. If you have access to a park that's less frequented, walk there.
Alex, I'd love to hear your take on if you directly partook in elements like that regarding your experience directly with the virus. I know you mentioned it was an extreme case of the flu, and I'm curious what other unique challenges did it pose for you beyond the respiratory issues? And also, more importantly, what kind of emotional impact did it have on you, considering you're in this super quarantine state and continue to be in?
Yeah, I'm glad you asked about that. I wanted to talk about that. I think one of the greatest challenges for me in this episode has been the quarantine, the isolation. In particular, in my case, I live alone in a Brooklyn apartment. I don't have a tremendous amount of space. I was trying to be very conscientious about the fact that at first I thought it was possible and quite likely that I had this illness. And then once I knowing that I needed to be, very aware of my neighbors, and I live in a building with 450 other units. So I was on complete lockdown here. I didn't step foot outside of my apartment. I didn't take deliveries. I just existed off of the supplies that I had, which fortunately were sufficient, with the exception of my trip to the ER. Yeah, no, I locked myself down completely, but the toll that took emotionally was significant. I'd never experienced anything like that before. I was thinking during it of Shawshank Redemption, a prison movie where at one point he talks about prison time being slow time. And that felt very true for me here. Every minute felt drawn out, where I had little to do other than read fatalistic, frightening news reports and medical literature about just how dire this disease can be, and to sit and ruminate on every last physical symptom arising in my body from moment to moment, and then catastrophize about it. And I'll say this, being alone, being isolated for such a long period of time, it turns your life into an echo chamber. Everything feels magnified. It's easy to lose perspective. So for me, what became very important, first I figured out, it took me a little while, but I figured out that reading every last piece of news about this disease was not good self-care. It was taking me down the rabbit hole into my own fear and my own catastrophic thinking. And what became very important for me in my survival of my emotional survival became my community, and it's really been powerful to me to have this digital community to lean into. My digital tools, social media, have never been actually quite so important to me. So having technologies like this, like Zoom, having FaceTime, being able to be in touch with all the other isolated people in my life has been a salvation in the course of this disease.
For sure. I appreciate that. And also, not to take anything away from everyone affected by the intensity of this disease. Like you said, it was kind of like a black hole of researching kind of fear-based information and other medical information. Currently there's the presidential election going on full steam, and there's no shortage of like global socio-political and economic tensions abroad and at home. And I'm wondering if this could potentially be by design in regards to any deeper agenda for any government to, quench the thirst of any conspiracy theorists out there, or do you think this is just like an honest outbreak and pandemic?
Sure. Again, I do not have any ownership on what is true, nor do I have any sort of special access to what's happening at the highest levels in our government or other governments. What I can say is this: is from a medical perspective, I cannot imagine creating something like this from scratch with the intention of somehow altering a particular political dynamic in one country or one region. This is a gigantic, blunt instrument that's affecting this entire planet at this point. To try and influence, for example, an election in the United States with this is like demolishing a house with a nuke. It doesn't make sense.
Totally.
And that said, we've seen this before. We've seen pandemics. This is not a shock. This is not a surprise. Shocking, yes, but this is also not been. This has been foreseen. We've had for years. We've had experts within the community of epidemiologists talking about how coronaviruses in particular are ripe for outbreaks. We saw it with SARS, but we managed to get a hold of it. We saw it with MERS, but we managed to get it boxed in. It was just a matter of time before something like this emerged and got out of the box. So, this is unsurprising, predictable, and catastrophic and devastating. That said, is it being used politically now that it's here? Sure, absolutely. I mean, I think where there are politics, they'll use whatever tools are available, and this is a big lever. The fear around this, is a powerful way to steer people. So I think we should all be careful about how we allow the messaging that surrounds us to influence our thinking and our behavior. So mindfulness in the face of this is important.
Yeah, I think that's a very valuable and objective way to look at it. And I'm curious too, for the general public, like what are things we can do to protect ourselves? For example, like wearing personal protective gloves and masks. Like how intense should we be taking those precautions? Say if we like go to the grocery store, do you think it would be helpful to be clutching on to gloves and masks and all that in a hazmat suit? I don't personally have a hazmat suit, but I'm going to try my best.
It's a good question. I think we should all be taking precautions on some level or other. It's going to depend a little bit on your own vulnerability. It's based on your age, based on whether you have pre-existing conditions that render you, more vulnerable. It's going to depend on your social circumstances. Do you live among vulnerable people? Are you in a dense community? Is your grocery store a local mom and pop that doesn't get much traffic, or is it a major supermarket with people, lined around the block for 2 hours waiting their turn to go in? Those are vastly different circumstances. So I would say full hazmat suit, probably not. But if you are vulnerable, see if you can get delivery, see if you can get somebody else in your household to pick things up for you, and to be careful about what they bring back in. So aggressive hand washing after they've picked through whatever groceries they've been, rifling through at the aisles.
Right.
I think the extent to which we can continue to follow good social distancing guidelines, like staying 6 feet away from each other, avoiding being in densely crowded places if you can. I think that's wise. But no, wearing gloves, the disease doesn't get to you through your hands. Your hands are just a way of transferring virus from one surface to your face, and your face is how it gets in. So you can wear gloves and touch a surface and then touch your face, and it's the same thing. Gloves are more like a reminder not to touch your face.
Got it.
So I don't personally, go around wearing gloves. I just am careful about what I touch, and disinfecting my hands, before I touch my face and after I touch my face. Mask, I think, we have to be careful about that. We're having critical supply shortages of masks that need to, because we're in limited supply, we need to use those where they're going to make the biggest difference. And right now that means keeping them in healthcare settings to the extent we can, because it's in hospitals that this disease is in its greatest concentration at the moment. And if healthcare professionals can't adequately protect themselves, then they start to become the spreaders of disease at greater scale than any of the rest of us can be, and especially among vulnerable populations. So I think the most important thing is to not go out and try and hoard a bunch of masks.
Yeah.
If you have a mask, then I think it's useful to use. If you're at risk, if you think that if you have symptoms, ideally you're staying home. But if you must go out, putting on a mask can protect everyone else from you if you're coughing. Most masks, the typical surgical masks that are kind of loose and flappy at the sides, they're not protecting you very much from the rest of the environment. They're protecting the environment from you. Then you hear about the N95 masks, which are the ones that are fitted, that actually form a seal like this so that you're breathing through the filtering material of the mask. Those can provide you with some protection from the rest of the world. So I think if you are a particularly vulnerable individual, if you're elderly, if you have, other pre-existing conditions that make you high risk, heart disease, high blood pressure, diabetes, existing lung conditions, et cetera, immunocompromised, then wearing one of those, if you must be out among other people, is probably a good idea. My dad's 82 and I tell him to wear a mask if he's going to go out, but I try to keep him inside.
Yeah. Got it. Thank you. That's definitely helpful. And I have one more question for you, Alex, before handing it off to Adam and Britt if they have any last things. And that question is, do you have any hope for this pandemic unfolding?
Oh, that's a tough question. I have hope. I have a lot of hope that we're taking it seriously. Mm-hmm. I have a lot of hope that we are starting to take the kinds of aggressive action at a social level, kind of responsibility at a personal level that we need to in order to bend the curve, as people have been saying, to slow down the spread of disease in this country, in other countries. I'm very hopeful that will allow us to reduce the number of people that end up getting very sick and dying unnecessarily. Do I have hope that this is going to be over in the next 2 weeks? Not really. I think that's pretty unlikely. Unfortunately, I suspect that we're going to be dealing with this disease as a presence in our daily lives and affecting the way in which we interact as a community for months, if not longer. Mm-hmm. Do I think it will involve a lockdown and an economic standstill in the same strictness that we're seeing now? I hope not. I think that we're going to learn more as we go on about how to keep ourselves and our vulnerable populations safe, and at the same time mobilize some of us back into work, into social commerce. Mm-hmm. I think we just need to be thoughtful about it and learn lessons from other communities, other countries. Mm-hmm. Yeah, I don't know exactly what it's going to look like, but I do believe that we'll get better at dealing with this.
Yeah, I agree. I think there's lots of silver linings at play, and we will be more equipped to handle this in the future. It's a trip to see and try to wrap my head around the overall economic ripples this is going to have. So hopefully that won't affect us too bad either, and we can all stay afloat. Adam, Britt, did you have any questions to add?
Yeah, I just have a sort of a personal question for Alex, having sort of come out the other side of this. Have you get any insights, any kind of learning for yourself? Really in that peak moment where you're just not sure which way it's going to go. That's a pretty scary time. Did you come out the other side with any kind of learning or insight that you're taking in your life?
Yeah, absolutely. And I'm going to go back to the danger of isolation and just how toxic that was in the setting of my illness, and how much worse the physical experience and the emotional experience of my illness was in my isolated state. And the learning for me was the power of connection. Once I really started leaning into that and using my community and allowed myself to be vulnerable enough to share with my friends and my broader community that I was sick and I was afraid, and people really showed up for me. I was spending much of my day, even in my feverish state, in connection with other people through FaceTime and Zoom and on the phone. That made a huge difference to my perspective on being sick and being alone physically. So the take home for me is just how important we all are to each other in our vulnerable moments, in our fear, in our fragility. Mm-hmm. And yeah, I'm trying to cling to that even as I emerge from this disease, knowing just how many people are struggling with this, at the same time.
Totally. The connection, even on a virtual level, is really crucial with our community and our loved ones to keep our well-being and mental health, on point. Thank you for adding that. And thank you for that question, Adam. Well, it looks like we're running out of time a little bit, but Alex, I can't thank you enough for sharing your time, experience, wisdom with us today. And Adam, your insight in helping put all this together, as well as Britt, your contributions. I'd also like to share a helpful one-stop shop for answers to many of the questions we have with a website that was just created by the state of California, covid19.ca.gov, which contains a ton of accessible, easy to digest updates and information about how to stay healthy and further prevent the spread of the coronavirus, with links to all the available resources for those in need of state assistance, including paid family leave, help for small business, access to testing and healthcare coverage, and more. And lastly, we all want to give a deep bow and thank you to everybody serving their community in this challenging moment, from all the medical professionals on the front lines to the grocery store employees, delivery drivers, public safety officials, maintenance workers, and beyond. Your contributions are seen, felt, and appreciated. Stay safe, stay positive, stay productive, and look out for one another. And together we will rise through this.
Wonderful.
Thank you, Dylan. Thank you, Alex.
For sure.